two things here now. The introduction of technology is not the right word, but the evolving changes that you're seeing now in technology, all of that coming in, concern me being non-clinical. Is that in any way, are we becoming more, or the clinicians or doctors becoming more reliant on technology? That's one. And second part, which is not so much connected but still linked to technology, is the introduction of online consultations. How do you see those?
Okay, so I think I'll come to the online consultation bit first. I think online consultations do have a role. My general preference is that physical examination and a face-to-face consultation is better whenever possible. Occasionally, if somebody wants an opinion because they live very far away or because of certain physical condition, like they've got some injury or some condition which prevents them leaving their home, then that can be done. But by and large, my advice is that a face-to-face consultation is better. It gives a better feel. It does allow for a better history taking. You can get a more detailed history because you're paying attention, the patient, and if applicable, their next of kin or family member is also paying more attention. So you get a more thorough history. You can pick up examination findings which cannot be done on the phone, whether a telephone or audiovisual consultation. Sometimes these diagnostic clues can be picked up better in person rather than on the telephone or an audiovisual platform for consultation. And often that reassurance that you give them is better in person. But of course, we are happy to do telephone consultations. But my advice is always is face-to-face consultations. We do get requests for online consultations, and we do them. But this had a significant role in the pandemic because obviously through various stages of the COVID pandemic, pre-vaccination and even post-vaccination, when we had the wave of inpatient admissions for patients with respiratory failure from COVID being admitted, I think it was a health and safety and infection control requirement to do lots of telephone consultations to reduce the spread of infection. That made sense. Touch wood, as these concerns have now eased away, I think we have reverted over the last 1 to 2 years, by and large, to a default face-to-face consultation unless somebody requests otherwise. So
before you go to your second part of the question, just a bit more on this. So now I see a trend in all of these new online clinics popping up. I mean, since the pandemic, there have been so many. Now, the role of those online clinics, and as a consultant, does it concern you? Does it worry you that is the governance done correctly for those online clinics? How do we assure to the patients that, as you mentioned, that physically seeing a patient is going to be definitely different than seeing them online? How do you ensure? I mean, as a consultant, are you worried about the governance? Are you worried about the compliance of those consultations?
I mean, there are various platforms. I presume, obviously, I can only speak for the places where I work. I can't speak for the places that I don't work. I'm aware of various online consultation platforms. I think most of them do require to have a robust governance mechanism, like you rightly pointed out, Zoe, because obviously the clinical governance framework is very important, as is the GDPR regulations. So yes, it is important. All those platforms should adhere them. I suppose most are. I'm aware of a lot of insurance companies, before they authorize a claim for a patient for a referral to a consultation for a consultant, they generally do a kind of digital telephone consultation. But it is my understanding, again, this is not from personal experience, it is my understanding that it is like a quick health check they do with the patient who has private medical insurance to understand what the symptoms are, and then they refer the patient. So in that case, it is basically serving as a referral pathway to a private practitioner. It is not like to treat it in that one episode. But my take is that if possible, a face-to-face consultation is always better. That is my general advice. And
going back to the first part of the question, which was the introduction of all the digital tools, the technology, are you worried that we are becoming more reliant on the technology? So
this is a double-edged thing. I think technology is advantageous, but we should use it with reasonable limits on it and not be dependent on it and not let it override our clinical judgment. in certain situations, right? I speak as a physician, as a respiratory and sleep consultant privately and on the NHS, but I'm aware of certain surgical colleagues, who use robots to do surgery. And my understanding from the evidence and data presented by them is that it is advantageous. So that can be a good thing. Another example is that, we have certain treatment algorithms done. Like, for example, when you screen for cancer, there are certain algorithms used to calculate the risk. So these have been developed after a lot of research on it. And AI is being used to, also like screen for certain symptoms and give you a possible diagnosis. A lot of patients, to be honest with me, as a consultant, I do see this change because, for example, I come across a lot of patients who come to me saying that my smartwatch has detected that my sleep is poor and I'm snoring and my oxygen level is dropping in the sleep. Could you test me for sleep apnea? Now, I never got patients on the NHS or privately coming to me like this 8 years ago, right? This has changed. So there is a role. So what I tell them is that, okay, your smartwatch, whether it's your Fitbit or Apple Watch, is not medically validated for this. We'll have to do a medically validated test like a sleep study to confirm if you have sleep apnea or not. I appreciate the concerns you said, but we have to use a medically validated test. Again, AI, there is a role for it. Like, for example, in screening for cancers, it has a role in robot-assisted surgery. My surgical colleagues will tell you more, especially the specialty surgeons who are using it in their practice. And also, like I speak about this, there is something called electromagnetic bronchoscopy or navigational bronchoscopy, which helps a pulmonologist or chest physician reach the small nodules or the peripheral lesions in the lung. So there is a role of it. And yes, but one shouldn't be over dependent on these things, because at the end of the day, I think the human judgment of a skilled, experienced practitioner is quite important. And if I look at it, my concern is that I'm slightly concerned when I see, for example, I sometimes see the next generation of doctors looking at CT scans before they see an X-ray. And I always tell them, please look at the X-ray first. Compare the chest X-ray to the old chest X-ray. Yes, you open the CT scan. Don't look at the CT scan before seeing the patient and examining them. All right? Go in a logical way. Take the history, examination findings, then look at the X-ray, compare it to the old X-rays, and then look at the scan from a learning point of view. All right. Because if one goes straight away to looking at the CT scans without examining the patient or without taking a thorough history, then I think that's not good medicine, and it won't help develop the same skills that, the other generation acquired. So there is a role of AI. I think there is no point in trying to say that wherever possible, we should take advantage of the AI delivered improvements, like in robotic surgery, like in screening for cancer, like in certain type of endoscopies like navigational bronchoscopy or electromagnetic bronchoscopy. But it's important to have an experienced consultant who is available to make the right decisions. Compassionate care, explaining something, breaking bad news, or counseling somebody about the lifestyle changes required, or explaining the diagnosis, what are the disease modifiable, lifestyle changes, risk factors which can be done. These things I don't think a robot can do as well. And I don't think any device like Alexa or any chat GTP can do, because, I sometimes have patients who have come and, they come across occasionally and they say that this is what the symptoms I had. I've researched this online and this is
I'll
what...
own up to that. I've done something
Correct.
similar.
And this is what it says is the diagnosis. So, I mean, I don't dismiss it. I do listen as a private practitioner, but I take my own history. I do my examination and my findings, and then I, listen to what they have to say. So I think it's important to embrace technology, but it's also important not to let it take control of the whole diagnostic process. Medicine is an art. All right. It's an art of science and on a balance of probabilities. It's not something that is a black and white thing that, 1 + 1 is 2 or 90 + 10 is 100. But it is a science based on, the experience, guidance and, evidence-based skills. And we should follow to these things. And I think it's always important to learn that. I think I've had some great mentors in, in India and in England as well. And I think what I would say is that they were all excellent clinicians, right? I think it is easier to develop, it's easier to learn to adjust your practice to the advances in technology. Like for example, if CT scanners or different types of diagnostic tests come into play a few years down the line, it is easier to learn about them and be skilled. But it is more difficult for a next generation doctor to learn clinical medicine if they have become less skilled in that because they've been too reliant on technology. Because that I'll phrase it in this particular way, because I've had some great mentors, and I think when I was resident doctor in India, I think one of my mentors told me, like, I'm very fortunate, like, I've worked with some of the best doctors, and I worked under the guidance of Dr. Farooq Udwadia. I would say he's a legendary, one of the most legendary doctors I've ever seen, and a great man. And he was practicing in Breach Candy Hospital in Mumbai at the age of 84. Probably one of the sharpest minds in medicine that I have ever seen, and maybe the sharpest mind that I will ever see in my life. But he used to tell us that it's quite easy to learn how to interpret diagnostic tests, but most of the next generation are actually lacking the clinical skills that are required. For example, one might know how to interpret a CT scan, but when one examines the tummy, some doctors may not be able to appreciate and feel the small spleen or the small liver, right, which is just mildly enlarged, and that comes with experience and good clinical skills. If these skills are not up to the mark, then I don't think the artificial intelligence can substitute that. But on the other hand, if someone is a good clinician or a good surgeon in their field, yes, if they are a good surgeon, they can make advantage of the advancements that come about.